Next, we'll be talking about how to maintain the neutral position during sit-to-stand transitions. A lot of my patients complain of pain during the sit-to-stand transition, sometimes even after a brief period of sitting, but especially after sitting for a long time. And once you know the correct way to move from sitting to standing while maintaining the in curve of the spine, this neutral position, you'd be surprised how easy it is and how much better you're going to feel. So let's talk about the way most people get up, and then we'll talk about the correct way to get up while maintaining a neutral position. Anytime that you want to stop this video and check for yourself the way that you get out of a chair, you can, and then just resume. But most people lean forward in their chair, their head is facing towards the ground, and then they push up with their legs, and then they lift their body straight up. And this position of movement in this bent over position where you have to stand up straight after you've already straightened your legs is definitely difficult on the spine, especially the discs. So what we want to do is we want to change the way that's done and get up a different way to avoid irritating the tissues every time you get out of the chair. So I'm going to talk to you about the sequence of how to do this with reduced irritation. So what you're going to want to do, the first thing you want to do is you want to move from the back of the chair to the front of the chair. So you kind of scoot your hips forward so that you're right at the edge of the chair, and put your feet underneath your knees so that if you look straight down over your knees, you're looking at your toes. And then sort of put one of them a little bit ahead and one of them a little bit behind. Your hands will be either on the armrests of the chair, on your knees, or on the edge of the chair. Now the critical part of this is that you want to maintain the lumbar neutral position. So before you go to stand up, I want you to lift up your chest and feel the back curve inward slightly. So you should start this activity with a slightly incurved position of your back. And then you lean forward from the hips while maintaining your chest up position. And as your chest comes over your knees, you push up with your arms and your legs, the whole time keeping your chest up. And you kind of want to think about your chest pointing to the opposite direction ceiling so that you keep that position straight up. This is the technique that will keep your back in a neutral position and again reduce the irritation that comes with slumping. And getting out of the chair incorrectly is basically a very exaggerated slump. So again, chest up, push up with your legs and hands, and don't let your back round out. Now when you're going to sit down, you're going to do the reverse. You're going to go find your chair and put your back to it. On the way down, your chest will remain up, pointed towards the opposite ceiling, and you will bend from your waist, bringing your body down slowly with your hand reaching back to the chair. Chest stays up the entire time. When you get to the chair, then you can scoot your hips back to the back of the chair, and of course, sitting at all times with some kind of a back support or lumbar pillow. So go ahead and try if you need to stop the video and see how you get up and out of a chair. And if you need to repeat this to see exactly what those steps were, please feel free. But the most important piece is chest up, lumbar spine curve slightly in on the way up and on the way down. Now I'm going to demonstrate how to get up out of a chair, maintaining that neutral in curve of the lower back. And again, doing this reduces tissue irritation of the lumbar spine. So what you want to do is you want to kind of move to the front of the chair like I am. So you kind of scoot until you're at the edge of the chair. Make sure your feet are underneath your knees and not too far out. And then your hands can either push up on your knees, on your chair, or on armrests if you have them. So I'm just going to keep mine on my knees. The most important piece of this transition is you need to keep your chest up. Don't allow it to round forward because this gives the out curve that we don't want. So this brings the lumbar spine into the slight in curve that is ideal. So So we're going to keep our hands down, chest up, and lean from the waist, and then push up into the standing position. And on the way down, same thing, chest up the entire time until your hips seat the chair. And then you can get yourself back in a position by scooting, and then of course using the lumbar support.